My name is Lisa Deckert. I'm one of the chaplains with Franciscan Health Spiritual Care Department. I am ordained in the American Baptist Church. I've been in the professional ministry for 35 years, and 21 years of that I have served here at Franciscan Health. Franciscan Health is a faith-based institution, and spiritual care services is the spirit piece of the mind-body-spirit vision that we have here at the hospital. I love the culture of Indianapolis, going to theater, restaurants. I love to walk, and we have a beautiful path here at Franciscan Health I've taken advantage of quite often. My cancer journey began in 2021. I noticed a lump in my left inguinal area, my groin, and pursued a visit with my nurse practitioner. And they also felt a mass up higher, and so that generated a CAT scan the next day. I pursued one of our pelvic surgeons here at Franciscan Health, and we talked through that process and the possibilities of what that might involve. I had surgery on September the 15th, 2021. She came out to my family about an hour into surgery and said, "We are not looking at uterine fibroids. This looks like ovarian cancer." And she was going out to speak with my family to get permission to bring in a colorectal surgeon. They were doing not only the radical hysterectomy, but as well a colon resection, an appendectomy, and ablated some places on my diaphragm. And so I think there was a little bit of shock and just not knowing what was coming. I think with any patients that we see, I think the uncertainty of what's ahead is the tough piece of finding out a diagnosis. So the process just continued to unfold. I was in recovery from surgery for about 4 weeks, and we set up a plan for chemotherapy. It was a hard process. I had no idea what to expect, but I was able to complete the 6 cycles, and about a month of recovery, I came back to work and was able to come back full time. You know, one of the hardest pieces was not being able to work during that time, and I thought ultimately I just embraced it and said that my full-time job was to just take care of my health and well-being so that I could get back to what I love. I would just say the entire cancer care clinical team, they're just phenomenal, from the physicians to the nurses to just the compassionate care and just the genuine interest in people really shone through. And I always knew that as an employee of the hospital, but it was a different experience as a patient, and to be on that side of it and also just experience the great love and devotion to patient care. I've always been a compassionate, empathetic, sympathetic person, but I think having experienced such a health crisis and just the uncertainty of what is ahead with that, it has made me even more empathetic to others' health situations. But you never know, I think, until something like this happens, really the love and care that people provide, and it came from so many, from the units that I covered, from just people in general that learned of my cancer and that I was going to be off for 6 months. That was probably one of the most overwhelming and comforting pieces of this, just to learn of others' love and care and attention. I hear a lot of people say, "You were so brave." And you never know how strong you can be until being strong is your only choice. And that's what I really felt. This was something that I had to experience. I had to go through. The care that I received here at Franciscan Health just boosted that strength that was shown to me, propelled me forward toward better health and healing and better days ahead, and I'm grateful.